Is she unmuted? Yeah. So she will now highlight her question, which was, see, I am seeing in the group for her question. So that, yes, yeah. First point is differentiate spinal, visceral, and somatic. You think spinal and somatic are different? Spinal and somatic are same.
Yes, sir. But
you have to differentiate
related to
between
nervous
somatic
system.
and visceral.
Yes, sir.
Somatic
but I've
is,
stated this differently. I've stated it differently because in spine, generally the neurons and CSF fluid, they come as different.
no, somatic
than
includes,
musculoskeletal somatic.
Somatic includes neurons, nerves. Nerves are not away from somatic. Okay. But in the nerves, for example, somatic nerves, that is median nerve, ulnar nerve, radial nerve. But what is visceral nerves? Nerves supplying the heart, vagus nerve. Okay, so that is visceral nerve. Autonomic nervous system, that ganglia and the nerves are visceral nerves. Somatic nerves. So in both it is there. Viscera means internal structures. The internal structures range from blood vessels to lymphatics to organs. Eye is a viscera. It's not somatic. But the muscles of the eye is somatic. So larynx is viscera. But the muscles of the larynx is somatic. The moment it is muscles means myofascial, articular, neural. It becomes somatic. Internal structures.
Voluntary or
organs,
involuntary.
Yeah.
Voluntary or involuntary, it will be somatic.
I am talking larynx muscle is voluntary. We don't talk involuntarily. I am talking about eye muscles outside I am talking. So it is not involuntary. I am not talking about ciliary muscles. I am telling external ocular muscles. So every muscle has its own nature of voluntary and involuntary. Involuntary muscle also, myocardium for example, whether it is viscera or it is somatic. Obviously, it is under the autonomic nervous system when it is involuntary means. Smooth muscle walls, what is there in the blood vessel and all, that muscle is not somatic. That is visceral. Stomach has the muscles. Intestine has the muscles. So those are all visceral. So they don't develop trigger points like skeletal. But skeletal muscles, somatic. Smooth muscles, visceral. Because they are part of visceral organs. Cardiac muscle, again visceral. So this is the type of anatomical classification of muscles. So remember that this is structural differentiation. In a patient, you want to differentiate somatic versus visceral because in osteopathy, you have a hypothesis like the pathology can be viscerosomatic or the pathology can be somatovisceral. So that means people having neck rotation problem, okay, with the neck rotation problem, people are also having dysfunction of trachea or the upper lobe of the lungs, viscera or thymus, thyroid, definitely. So these are all visceral. Rotation, correct. But how do you differentiate a viscera from somatic? Palpation is viscera. Every viscera is identified only by palpation. There's no other additional testing. Diagnostic ultrasound and all laboratory. But if you see somatic, somatic is by movement testing. Somatic is by contraction testing. Patient having rotation problem, maybe thyroid problem, so is not able to rotate. He might get a pain, but that pain will not increase with the contraction here. Or contraction this side will not aggravate the pain. If it aggravates the pain, it is rotators of the neck. That is somatic component. For other example, which you would not have noticed even from osteopaths who are teaching, differentiating between viscerosomatic and somatovisceral. First, palpate the thyroid, then you rotate. The symptoms are worse. It means that I'm giving visceral stimulus, then somatic movement. Versus next one, I do rotation, then I palpate the thyroid. Somatic, then the visceral stimulus. It will tell whether the patient problem is somatovisceral or viscerosomatic. This is what we simplify in our cranial course, visceral course. Don't think that I'm against osteopathy, because osteopathy is a different profession. I respect it as a distinct profession. Physios should know the pathomechanical perspective of osteopathy. They can join cranial osteomanual therapy and viscerosomatic manual therapy. It involves releasing somatic muscles together with palpating the viscera, releasing the ligament around the viscera with the corresponding muscles that are innervated. Viscerosomatic. A spinal manipulation is a somatovisceral. Our focus is always that we treat the spine and then we expect the change in the viscera. Kidney problem is there. You treat the T12, L1, L2, spine. Okay. But kidney visceral problem affecting quadratus lumborum, affecting psoas major, affecting the transversus abdominis. That is viscerosomatic manual therapy. How you influence the kidney through these muscles, not just palpating in the back, or you imagine through the aorta spina how much you can palpate a kidney. So if somebody tells that to keep the hand there, means you are giving renal manipulation. Huh? Nothing will happen. That is structural treatment. We have to activate the muscles which are close to the fascia of the kidney. We have to activate the psoas major for the ureter. So like that for calculi. So that means first which muscle you activate, next which muscle you activate. How do you position the patient and then palpate? Viscerosomatic manual therapy is like, it is like visceral pathomechanics. And we have done visceral IASTM, visceral kinesiological taping, visceral cupping. All those people triple certification they are teaching. Ask them how to do for viscera. AOMPT has visceral triple certification. And that is pathomechanics. And you do that, you feel that, you know that with the pressure that you give, isolated stretch versus palpation and then stretch. A stretch with a contraction, somatic, changing the symptoms. A movement with a palpation, visceral. So, and not only this, use of tuning fork, use of percussion hammer, because ligaments around the viscera can be tested by percussion hammer. One of the participants was an osteopath from Philippines, Leo Mill, our core committee member. He has not missed one single course of AOMPT. He told that neither any physical therapist in the world nor any osteopath has taught what AOMPT has taught me. He is a resource person in Philippines. Soma Fails. That is the name of the group which is providing courses. Leomil, Patinao, Adriano. And he is not missing one single course of AOMPT because he knows the value of the knowledge what we teach. He is an osteopathy resource person, but he is attending our courses.
I wanted to do it offline.
Philosophical background is osteopathy. It's more of structural focus. Go to that region and then see holistic treatment, multi-structural, all that. But pathomechanics, it is never it comes. in osteopathy domain. It comes in physical therapy. This pathomechanics made him to relate the techniques better. Why, when we use even a cranial technique, we will not use only cranial technique. We will use neck muscles together. We will use that cranial nerve neural mobilization. We will use what and what not, even vascular techniques together. So that is what we are exploring in that patient-centered perspective and advancing physiotherapy profession through pathomechanical integration, even facial distortion model. We had a pathomechanical integration into facial dysfunction model that is under the AOMP. Facial distortion model is structural, but facial dysfunction model is functional with muscle contractions. If it is muscular, means a concentric contraction will be there together. Tendon means eccentric contraction will be there. Because mechanically tendon is loaded with the eccentric contraction. For every muscle, so you may not know even how to eccentrically activate the particular muscle. Because eccentric contraction is not at all trained. But the eccentric contraction only is functional. Functional recovery will come only if eccentric training is given. So think of the gaps, not only in the knowledge or in the techniques, it is also in the decision making behind the techniques. And the fundamental basis, the pathomechanics, should be the guiding force for the decision making. Ultimately, in reality, if you have to be successful, we have to learn for reality. So that is patient-centered education. So that is what will make you competent enough to handle your cases, extreme spectrum of cases, not like average people, everybody you give one technique, they'll be improving. Not that. Either the lowest category or the highest category. Extreme category also you should be confident to treat. That is the reality. Every group. You will not take a complicated patient, but in a single case, which is a complicated case, they will take. So case study is important for practice-based evidence, not randomized control trials, which is evidence-based practice. Don't base your decision depending upon randomized control trials. It is random and it is out of control and it is a trial and error. You can better base your decisions on the case studies, single case studies which are published, because they have the depth of decision making. What was the finding on first day? What the therapist thought, used that? What was the progress second day? What is third day? It may not match with your patient, but at least the program of how the decision making goes in the therapist will be highlighted in a case study which is published, not the randomized control trial. The randomized control trial will explain the treatment procedure, but they will not explain the decision making. And they will treat all patients as same. Control group, all of them will get the same treatment. Experimental group, all of them will get the same treatment. So randomized control trial is the worst strategy to make a decision that is evidence-based. No. But case studies, nowadays very less people are publishing case studies because it's very difficult to explore the depth of a decision making in a case. But if you see, people like Ritu ma'am have taken many case webinars. People who are sincere clinicians will go into the depth of the thinking process. They will not be satisfied with the patient improvement, which is 50%. They will ask what more we can do. What have I done? She's also a self-critic. Even if she does correctly, also she will ask whether I am doing correctly. Okay. But that self-reflection should be there, not a criticism. You should reflect upon yourself and see that whether you have done the best for your patient, whether you have got the best understanding of the patient. When you attend courses which are reality-based training, while you are attending the course, you will get that, oh, 2 years back, I treated that patient. Okay, this only happened there. You'll be able to relate it with reality. When it is technique centeredness, you will be like, magical experience will be there that 2-3 days. And you will be like, fourth day, whoever comes, I have to use this technique. That is technique centeredness. You understood? So try to see how clinically you can upgrade, so that, because clinicians, you have a clinic, every type of patient will come. You will have to decide between, in a hypertension patient, whether you want to do a vascular manipulative therapy, or you want to treat the heart, or you want to treat the venous. Because peripheral vascular resistance is venous, which will increase the blood pressure. Arterial, atherosclerosis, that resistance also will be the blood pressure. And cardiac output directly related to the systolic blood pressure. So you can, all this beyond this, vagus nerve parasympathetic is there. You can use it for blood pressure. Or sympathetic chain you want to deactivate for blood pressure, because hypertension, increased blood pressure comes from sympathetic overactivation. So beyond all this, the hypertension can be from renal or hepatic, organ related causes. So that we are not going to prescribe calcium channel blockers. We are not going to give any, these kind of drugs. But most importantly, in that patient with hypertension, what is the picture behind it? We are not treating hypertension. We are treating a patient with hypertension. And then if the patient tells that whenever I'm getting tensed, my blood pressure shoots up immediately, you know that sympathetic nervous system is maladaptive. So desensitize the sympathetic nervous system. Another person who tells that in the late night, suddenly I wake up with restlessness, or I get catching in the breath, and I feel anxious, parasympathetic. Every organ has its picture. The dysfunction, food, for example, you want peptic ulcer, which is in maybe a coexisting symptom in a patient with hypertension, because both are sympathetic hyperactivity. Peptic ulcer also, hypertension also. So it may not be that stomach is causing the hypertension. Okay, it's a two disorders, but the common cause is sympathetic nervous system. So there you will use thoracic spine thrust technique. Why? Not for somatic problem. It is a visceral problem. But thoracic spine, sympathetic ganglia, close approximity. Thoracic spine has central mechanism of pain relief. You can use thoracic spine thrust for any problem in the body, except it is thoracic spine fracture, which you are not supposed to use. Okay? Otherwise, you can use for every part of the body. Because central phenomena, placebo, descending inhibition, central sensitization syndrome, thrust manipulation to thorax will help. Migraine. Is that thorax to the head connection is there? No. Thorax to the brain, head also to the brain. Both are there. Brain. So the treatment effect is mediated by the central nervous system. So there are things which you have to explore, and you have to invest and dedicate, because you have paid money in the college. I'm telling physiotherapists, 4 years they are paying 4 lakhs. They pay 200 rupees per day, 500 rupees per day. 200 teaching days only in a year, and you are paying 1 lakh. Means 500 rupees you are paying every day to the college. So why can't you think and do that some courses valuable, which will make you a better therapist? When you are excellent, automatically money will come. If you run behind money, you'll be a beggar. You run behind excellence, you'll be a legend. And the money will beg, please take me, please take me. Even fresh graduates, I tell, they ask where job. I tell, don't search for jobs. Search for excellence. Keep doing things to project your excellence. Job offers will come. You ask Silka, she took a free webinar. Many physios would have asked that. Have you completed osteopathy? You want to work in a clinic? You can come to my physio clinic. Understood? So improve your performance. Stay connected with excellence. It's an investment. Opportunities will come. If you are great, greatness will always come to you. Greatness is not by being the best. Greatness is making others the best. Clinician means patients should be becoming best. Teacher means students should be becoming best. Research means knowledge has to be becoming best. That is the commitment. Then you are great. Immortal. There was a meaning for your life. It's not just Akansha who was born on this year and died this year. It's Akansha Yadav who changed people's lives. That's the meaning of your life. Everybody should think. COVID time alone, we are afraid of death. But we should think that what is the usefulness of life? That is important question that we have to answer. What I have done, okay? Whether I am with the best people, am I better than how I was last month? Whether I am sincerely doing efforts to make other people better. After that, if nothing comes also, no problem. Because the way of life itself is a satisfaction. You don't have to get anything in return. Because if you don't get anything in return in this life means, after your death, you will get everything together fully with a lot of affection from God. If you are getting in life itself means, after death, you may not get that much. So think like that. Don't worry. Death is not an end of life. Death is only an afterlife. Yes.
Sir,
Whatever. Student council representative Silka will tell now. Yeah.
Sir, the point you said that the isolated stretch is for somatic and palpitation plus stretch
Not
is for
stretch alone.
viscera.
Movement testing.
Okay.
Muscle
Movement
testing.
test.
Kinetic, kinematic. Kinematic is movement testing. Kinetic is muscle testing. That's all.
Yes, sir.
Stretch is something which I told as a patient symptom. When you are doing this, they are getting stretching. And then you give contractions and all that. Don't try to experiment because you will not be able to do any of this on patients unless you take the course. Also remember, this session video recording also AOMPT members can always purchase. So that the decision making, when you listen again, you will definitely get a better insight. Part 2, why I have kept? Because some people did not know even how to ask a question. So those people will get some idea after reading all these questions and today's session, everything. Then attending today, they would have watched. So they will ask better questions. So then, anyway, it is Independence Day. We have to be independent from in our decision making. Okay. We cannot be dependent on that person taught me, so I have to do. I am certified practitioner, so I have to do. And then you ask, how many repetitions I have to do? How much pressure I should use there? Okay, so that is technique. It is not that. Patient feels comfortable, give more pressure. You feel uncomfortable, give less pressure. What is there? Why you have to measure the pressure? If you are measuring the pressure means you are becoming like a mathematician there, not a clinician. So if somebody teaches like this much only, you have to give pressure. Okay. You feel the energy there? That energy only you have to feel. Bioenergetic model. Okay, craniosacral therapy. Okay. We should see that what way patient oriented it can be done.
Yes, sir.
People who have not taken clinical courses of AOMPT will not recognize. But that is why I have given the opportunity of IASTM practitioner, which is practical demonstration for people who are ignorant to burn their ignorance. Because people don't realize the value of knowledge unless it is practically shown. Practically, the IASTM practitioner videos, sessions, people are getting that benefit. This August, people have attended 2 master classes and they know. So like that, if that can be different, IASTM can be different, why not a Maitland's technique will be different? Definitely. Maitland's technique taught by AOMPT is different from Maitland's technique taught by Maitland's instructors. Because that is technique centered, we are patient centered. This is what is the difference. We don't teach only Maitland, we teach what other things you can do together to suit every spectrum of patient. We don't select the patients for the technique. We select the techniques for the patient. So this is important for clinicians to think and upgrade. Ritu ma'am had an appointment with the consultant, so she left. Krishna? What, Krishna? Phone also you connected in the charger.
Yes, sir, I reached home. But AMPT charge will never decrease.
Okay. So we'll close the session today.
Sir, there are
Right.
2 more questions. That was
You
just
keep
one.
even, it's never ending. That's why second part, third part courses are there. Because we start at 4 o'clock and we are going till 7:30 and all, it's madness. Understood?
Yes, sir.
You should think that you should not exploit a resource person. Somebody is teaching, respect the knowledge and join their courses. I am selfless or selfishless. Okay. I cannot compromise myself and try to allow myself to made a fool. Okay. What I'm trying to tell is, diamonds are not for throwing in the road. When other people are throwing glass particles and you think that it is diamond. When it is valuable diamonds, people should take courses. Because after the course, you will understand that you will answer others' questions. It's not only your question. That is the difference. And the course you take today, course you take 1 year later, it will be double fee. So do not postpone your excellence. You will pay higher fee. People don't think that you are a student. You take the video now, you can watch it 1 year later. Or those who have done the video course, it is a free for direct courses. In the future, same course is conducted anywhere in India, you can attend for free. AOMPT is like that. All the videos are lifetime access, not like 3 months, 6 months. All videos are downloadable. You can save in your hard disk. It's not like website which gives like you can only watch. You can't even do a screen recording. If you record screen recording, audio won't come. That is commercially distributed courses. So take and see that, because questions will come. There's never an end for questions unless you do the courses. You do the courses, then question comes. We have an obligation to address that because it will make the course better. Without doing the course, you are asking questions is only for making you to know the importance of the course. We answer your queries so that you know that our answer itself is different. So the course will be definitely different. There's a proof. It's like a sample. Okay, you tested. You go to a sweet shop. You ask for halwa for tasting. You take one halwa, another halwa, another halwa. Everything you want to taste means what the shopkeeper will do. He will look at you like this. You came to taste or you came to eat it? One by one, every halwa you are just tasting, and you are eating Mysore pak, all that. So same like that. Understand that if you have tasted, you should take the halwa if you like it. If you don't like it, second one which you like, you should take it. Without buying the halwa, if you are just tasting the halwa means, first time the sweet shop person might allow. because you are a kid. Second time when the same kid comes also, he will tell, ask your father to come. Okay. So understand that the value for knowledge is also like that only. We can't underestimate knowledge by thinking that all knowledge we can learn only for free. Yes, very hardworking people, you can see YouTube, you can see, learn from books, you can run around to people, their clinics and everything, you can observe and you can learn. But the problem with that learning is it will take 50 years to learn. It's not that impossible. Okay. If I have spent 20 years to learn, I expect that ordinary physio has to spend 50. Okay. Because I have not attended courses of anybody. I have just attended maybe some few free webinars. That's all. I have developed my courses. Same way people can develop. But to come to that stage, you will have to make your effort. So understand that importance.
This courses, I feel that online and this is not what I learned amidst this COVID, and this is that online is just not for me. I want to do it offline and physically. Unless you know, palpate
That is
how
your
it
own
feels
choices. You can just
exactly.
keep on postponing.
Yes,
Unrealistic
that's
learning.
why I'm not.
8 hours, one whole day, 20 minutes, 10 minutes demonstration, 20 minutes practice for the participants. Half an hour. 16 techniques only will be taught in one day. In that 16 techniques, if participants are 32 participants, you will get chance for maximum 2 techniques where the instructor comes and checks your technique. Other 14 techniques, participants tell you that, yeah, sir, told me that it's correct. What you are doing is correct. If you call the resource person in a direct workshop, come and check means 32 people are there. All 32 will be standing together and you will be watching. Center, they are demonstrating. You don't know where the hand is. You are not having a camera below the head. In AOMPT, it is there camera inside, showing inside the mouth for palate techniques. Precision is important. It's not the environment. Precision does not come with physical training. Precision comes with intellectual training. The difference between cognitive factor and behavioral. See, behavioral training is physical aspect. Anybody can do. You just see a dance in the video, you start dancing, and your dance will become same as the person who's dancing in the video. That is behavioral part. But what is the intellectual part? For that particular song, how to design the steps. If the music is like that, means what steps should be there. That is intellectual part. If I am trained for the cognitive part, I don't need a video for a dance. I will make my own steps. And my dance moves will look attractive. So same like that, technical versus intellectual. Try to differentiate and see which is important. Most of the osteopathy courses, they do this. All this. Understood? So they want that because their business is that only. So they want the people to be attending the courses every 6 months. They will be doing the course only. Because 5 months in between, if they don't use any technique, means they'll feel like whether I'm doing correctly or not. They have doubt. Again, they want to do that course. Basic, intermediate, advanced, every level. Why? You have the strongest foundation. You can only advance the technique. Intellectual part is designing the what is called as architecture of the house. You are telling that I should learn how to keep the brick and how to keep the cement. You want to be a construction worker or you want to be an engineer?
Excuse me, sir.
So if I
My
have to be a construction
patient.
worker, I attend a workshop for the construction. I practice how to keep the brick and cementers and everything. That is direct workshop. You can leave, Silka. I am not telling you to sit. Point is, make sure that give the priority. And when people are giving the guarantee that AOMPT's online courses, we have 3 hours of content, online video. That 3-hour video is equivalent to 1 whole day of workshop, 8 hours of workshop. Because rich content, there is no pause. 10 minutes, practice for half an hour. 10 minutes, practice for half an hour. No, this is 3 hours. And the subject of the content. Okay, so that is who is teaching what. The feasibility of a direct workshop. You need 30 people to organize a direct workshop. When you tell amongst your friends whether 30 people will be ready for a direct workshop, then you call me, I will come and conduct. But you take the video option, direct workshop is free. So which is bigger? Direct workshop, you will not get video. Video option, direct workshop is free. So which is bigger? Lifetime access videos, intellectual, versus one time you just record in your phone because others are recording, you are also recording. Never anybody watches that phone recording. I am very, very sure. What, Krishna? People all will do recording. Once it is transferred to the hard disk or to the laptop, nobody will open that video. Akansha, she might have videos of the workshop. Other people will tell, hey, give me the demo for video. That's her, sir. Give. They will take it in pen drive. Whether they will watch, they don't watch even after passing out BPT. Point is, direct workshop is just enjoyment with friends. 5 people, 10 people, you join together, you will have fun. And then AC hall, nice food workshop. Certificate with resource person, the photo is there. So that is more attractive if the resource person is an international lady, foreigner lady, with very attractive clothing. Pilates workshops are like that only. You can watch the resource person for 10 hours, no problem at all. You will never feel hungry. That is what they are doing. Pilates workshop. See, point is, we have to see in what way we have to become better. Whether we are becoming better in hands or in heart. So that is what is important. So knowledge, empathy, that makes better experts than physical training. Understood? So, like Dr. Anup sir and all experienced clinicians.
Sir, you are muted.
There are a lot of interprofessional issues everywhere. But still we are able to do our best for patients is only because we are learning from the best. So that is what makes. So we close this session and ensure that you people can participate in the part 2. You will see different types of questions. I will be answering that. And also that the reserved slot like Dr. I'm getting because of the call. So we close the session and wishing you all the best of luck. Stay smiling, stay inspiring, and make your prompt decisions at the perfect time. More you delay, you will feel that I am 40 years, still I don't know anything. Okay? Life will delay you. Okay? Because you have delayed the excellence. Right? So don't take the chances. You do 10 courses of 5 different academies, whatever. After that, finally you do AOMPT course, then only you will understand the subject. Right. See you. Bye-bye.
Thank you, sir. Thank
I
you so much.
close. Yeah, Ritu ma'am.
Thank you.
Akansha, Dr. Anup, Dr. Krishna,
Thank you, sir. Thank
Dr. Nikita.
you, ma'am. Thank you, Ritu, ma'am.